forth. And I also welcome Dr. Pavandeep, Pavan Amandeep, who have been working with this program. I also welcome my other eminent speaker, Dr. Rimple Sharma, who is Associate Professor of Pediatric Nursing in College of Nursing, AIMS. And above all, I also welcome all the colleagues, the organizing committee, the executive committee of NTAI, Delhi NCR, and all the members of NTAI, also the nursing students, my colleagues, and all. So thank you all for joining us. I think many more will join, irrespective of being Sunday. Most of them have already joined. And you will be quite a lot benefited with the able discussion of the actual work by our esteemed speakers. I really feel very happy to see that Dr. Dadich has accepted our invitation, and because this day nobody else could be do justice with this week other than Dr. Dadich. So as we all know that the every year breastfeeding week is celebrated between August 1st and August 7th all over the world, around more than 170 countries around the world. And this breastfeeding week was initially initiated in 1992 after the Alliance for World Breastfeeding Action was established in 1991, which coordinates all the campaigns of breastfeeding week across the world with the objective of informing, with the objective of anchoring the breastfeeding agenda with the countries, informing all the countries about the theme, and also galvanizing the action or engaging the people who have the impact, and also galvanizing the actions and all related issues. So this breastfeeding week has also been aligned with sustainable development goals in 2016, and in also 2018. You will be happy to know that United Nations World Health Assembly has endorsed this breastfeeding week as a very important strategy for promoting the breastfeeding across the globe. So the theme today, which we have been given this year, is Step Up for Breastfeeding, Educate and Support. And we know that this theme seeks to involve all the stakeholders, the governments, the individuals, the communities, the organizations, and everyone. And it also tells us about the creating of awareness about sustainable breastfeeding environment. So breastfeeding promotion, protection, and all is okay, but you have to sustain the breast. Once you have taught, then once you have given the awareness, and you have to sustain the breastfeeding environment. And the main focus, our educational policy 2020 has also focused on capacity building in all spheres of life. So I'm also seeing the same thing being followed in the theme of the breastfeeding. The focus of the theme is focusing on capacity building of the actors. We mean say all the people who are involved in promoting breastfeeding. So creating a capacity building environment that have to protect, promote, and support breastfeeding at all levels of the society. And there has been said that actors have to make a warm chain of support breastfeeding. And in this, the targets are everybody. That is, the governments are the targets, the associations, the institutions, and all the stakeholders are the targets, and they have to take. So I, on behalf of the Nurse Teacher Association, request you to take a pledge today that though we have done a lot of work in breastfeeding promotion, because till now we have not reach the targets of exclusive breastfeeding, because the WHO target for exclusive breastfeeding is around at least 50%, which has to be reached by 2030. So if you all, and we also see that the key for promotion and protection and some supporting of breastfeeding is skilled counseling. And this skilled counseling has a major role from the point of view of the nursing professionals, because it's the nursing professionals who are working across the globe in at all levels, in the community, in the hospitals, home settings, everywhere. So they have a very tremendous role to play in skilled counseling, so that breastfeeding awareness can reach to every corner of the world, every corner of the home, I should say. Because even though the people, we say, we talk of educated people, even though the educated people know about the benefits of exclusive breastfeeding, but when you see the practice, they provide the bottle feeding to their kids, and when you ask them, they say, no, it's not practical. Yes, we know that breastfeeding and feeding with the feeding with the bottle, any feed with the bottle is harmful, we know it, but it's not practical to use anything else. So we have to create, that is why the sustainability is very, very important. So the with these words, I think I must not take much time. I would request the Pawan to go ahead with the uh, giving some remarks of our national president, Dr. Farooq, and then we can start the session.
Okay, thank you very much, ma'am. Ma'am, your words always enlighten us, ma'am. You have very specifically and very in a very short manner you have explained about the present theme, and thank you very much, ma'am, for that. Now I invite our national president NTAI, Dr. Farooq Khan, to share his word of wisdom with us. Over to Dr. Farooq.
Yeah, thank you, Pawan sir, and thank you, Pretty Call ma'am. And a very good morning, ladies and gentlemen. NTI Delhi NCR chapter, in collaboration with Pediatric and Neonatal Nurses Forum India, organizing today's webinar on Breastfeeding Week 2022. And this year, the Breastfeeding Week, the topic, the theme is set step up for breastfeeding, educate and support. By the theme, we can see what the theme is telling to us. And today's eminent speaker, Dr. J.P. Dhadi sir, Senior Consultant Neonatology, Fortis Escort Hospital, Jaipur. And another most talented speaker, Dr. Rimpal Sharma, Associate Professor, AIMS, Delhi. And our National Secretary, Dr. Manish Kumar, NTI, and Professor Poonam Thakur, National Treasurer, NTI. And I congratulate all the organizing team members of the webinar, especially Professor Dr. Pretty Call ma'am, President Delhi NCR chapter and National President PNNFI, and Professor S.C. Rawat sir, Secretary PNNFI, Professor Dr. Pawan Kumar Sharma, Secretary, Ms. Amandeep Kaur, Chairperson, Peer Review, NTI Delhi NCR chapter. So to all members, to all the organizing team members of this webinar, I congratulate to them. If we talk about Breastfeeding Week 2022, so World Breastfeeding Week is a global campaign to raise awareness and cleanliness action on themes related to breastfeeding. WABA, WABA, World Alliance for Breastfeeding Action, coordinate the Global World Breastfeeding Week campaigning that aim to inform, anchor, engage, galvanize action on breastfeeding. And we know World Alliance for Breastfeeding Action, WABA, is a global network of individuals and organizations dedicated to the protection, promotion, and support of breastfeeding worldwide. And you know, since 2016, we are organizing this Breastfeeding Week between August 1st to 7th. So this is all about our Breastfeeding Week. So today we will enhance our knowledge by the eminent speaker, Dr. J.P. Dhadi sir. So let's proceed the session and let's proceed the webinar and update our knowledge from the eminent speakers. And I congratulate and best wishes to today's participants. So regarding the breastfeeding week, we will update our knowledge. Thank you so much. Thank you to all the organizing team members. Thank you all.
Thank you very much, Dr. Farooq Khan, National President, NTI. And you have explained in a very crisp manner again. And you have answered. I want to thank you that you have always supported us in every manner, every time. Whenever we message you something, we got immediate reply. And thank you very much, sir, for your constant support and encouragement.
Thank you, Pawan sir.
Okay, sir, moving forward, as Rawat sir has not joined, so let me introduce our first esteemed speaker, expert, Dr. J.P. Dadis. So Dr. J.P. Dadis, MD Pediatric, he is presently working as Senior Consultant Neonatology, Fortis Escort Hospital, Jaipur, Rajasthan. Sir has a special interest in newborn care, developmental neurology, infant and young child feeding, and child nutrition. Sir has more than 40 publications in peer-reviewed scientific journals and more than 20 chapters in various books. Sir has contributed to several reports, compendiums, guidelines by government agencies, professional organizations, and UN agencies. Sir is reviewer of 12 international and national peer-reviewed scientific journals. Sir is a recipient of prestigious fellowship of National Neonatology Forum of India for outstanding contribution in the field of neonatology. Sir is member of IMS Act Committee for the IAP IYCF chapter. Sir is former co-chair Global Council of International Baby Food Action Network. And sir was there from 2016 to 2021. Sir is a former secretary NNF 2003 to 4. Sir is former national coordinator BPNI 2009 to 2021. Sir has participated in more than 200 conferences, CME, and academic meetings as a resource person. And sir is trainer for national and international courses on IYCF, International Code, Neonatal Resuscitation, and Newborn Care. Sir, on the behalf of NTI Delhi NCI chapter, I welcome you and I invite you for your word of wisdom. Over to Dr. J.P. Dadis.
Thank you, Dr. Sharma, for this kind introduction. Before I start, I would like to thank PNNFI and NTAI, and particularly all the office bearers. Dr. Piti Kaul, I have a long association with Madam since 2003-4 when I was the secretary and Ma'am was the executive member of NNF. Dr. Khan, Dr. Rawat, though he's not here, Dr. Sharma, and Ms. Amandeep Kaur, and all the participants. So, friends, before I start my presentation, let me try to share my screen first. Yeah. Can you see my screen?
Yes, sir.
Yeah. So before I start speaking on the topic which is given to me, I would like to respond to what Dr. Paul and Dr. Khan and Dr. Sharma, you just said about the World Breastfeeding Week. As rightly said by Dr. Pitikol, that this celebration started in 1992 when Baba first announced World Breastfeeding Week to be celebrated during the first week of August in 1992. We were in BPNI was in very nascent stage. It was actually founded in 1991, and 1992 World Breastfeeding Week started, and we were there to observe the first World Breastfeeding Week. I remember we prepared an action folder for India according to Indian situations, and we because there was not much money or not much human resource available to us, two, three of us, we ourselves put the folders in the envelopes and put the stickers, so address stickers on them, and then posted them to our BPNI members. At that time, for the first World Breastfeeding Week, the theme was Baby Friendly Hospital Initiative, BFHI. And I'm after, even after 30 years, it's 30 years now. After 30 years, we are still talking about how we can improve the hospital practices. The situation is not very encouraging as of yet. I mean, in last 30 years, though things, the awareness has increased. People have started talking about breastfeeding, which was not there earlier. And in as Dr. Pitikol said, that in curriculums now breastfeeding is included in nursing curriculum as well as in curriculum of medical students. But still a lot of things is required at hospital level, because when we say that the initiation of breastfeeding should be done within 1 hour, and when we see our data, it's only 41, 42%. I mean, most of the deliveries are happening in our hospitals now, about 90%, but the initiation is only 41, 42%, 43%. So a lot of things has to be done in hospitals, the healthcare facilities. Then I also would like to congratulate Dr. Pritikol when she used the word actors. I like this word because we all are actors actually. There is a tendency to use the word stakeholders, which I don't like, because stakeholders is something very commercial. When we say actors, it means we all are acting to improve breastfeeding. So it's it's the responsibility of all of us. Then we come to the theme of this year: step up for breastfeeding, educate and support. So what does it mean? Actually, I was part of the team who reviewed this global action folder prepared by WABA. And we found that when we say educate, educate means it's not only the mother, the family, the society, it's also the healthcare workers and the nutrition care workers who are going to support mothers to be successful in breastfeeding. So we have to keep this in mind. It's not only about mothers and family and about society. It's also about us. I mean, those who are working with the newborns, those who are working with children, we need to educate ourselves and enhance our skills so that we can counsel the mothers. You rightly mentioned counseling also. We need to counsel the mother. And there are beautiful guidelines available from WHO, from Government of India, various other agencies, which says that during the antenatal period, mother needs counseling. At the time of birth, mother needs skilled support. And in postnatal period, also, mother needs counseling up to 2 years even. So that if there are any challenges, then they can be addressed. So when I talk to the topic which is allotted to me today, and it's a very specific group of babies, and we have seen in last 30, 40 years that the paradigm of newborn care, and you will agree with me, Professor Cole, that the paradigm of newborn care has changed tremendously in our country. Earlier, we used to, there were not many neonatal units. There were not many what to talk about neonatal intensive care units, level 3 units. There were not many of them. But now we see in all, even in smaller places, and with the Government of India's facility-based newborn care program, now we have at least one level 2 unit in each district. So the newborn care has improved a lot in our country. But when we talk about use of breast milk in these units, probably we have to do a lot more, because all other things, equipments and all other protocols are there. But at the same time, when we talk about nutrition of preterm babies, and when we talk about breast milk to be given to these babies, we need to do more. So in next 15-20 minutes, I will talk about what does evidence says about using breastfeeding or breast milk feeding of preterm babies. My talk, my outline of my talk will revolve around these three issues. And I will be very brief, because it will not be possible to cover everything in 15-20 minutes, but I will be to the point. Number one, why breast milk is the perfect nutrition for the preterm infants. Second will be, what are the health benefits of breast milk to the preterm infants? Because it's not only food for the preterm babies. We are worried about their survival, and we are worried about their intact survival actually. So how breast milk helps in achieving this goal? Then what needs to be done to enhance procurement of breast milk, particularly in neonatal units? Because it's really challenging to procure milk from the family, from the mother, for their sick neonates. So the first, breast milk, why breast milk is the perfect nutrition for the preterm infants. Let's see what evidence says about this. They were, NNF did a good thing in 2020. They came out with evidence-based clinical practice guidelines on various topics. And one of them was breast milk for preterm babies, and another one was for feeding of low birth weight neonates. And these guidelines, they say, what are the options for providing nutrition to low birth weight term infants? Bearing few neonates who cannot receive enteral feeds because of various reasons, because of their sickness or something else. The preferred method of feeding preterm babies is expressed breast milk from their own mother. We call it MOM, mother's own milk. If mother's own milk is not available due to certain reasons, then pasteurized donor human milk should be used. And even if both these commodities are not available, then only then preterm or term formula should be used. So these recommendations are now global recommendations, and NNF also adopted these. And these are developed using the GRADE method, which uses all the systematic reviews, Cochrane reviews, and meta-analysis. So these are all evidence-based recommendations now. So when we talk about preterm feeding, why it's a special group? I mean, what's the need of talking about preterm babies especially? Because they have several handicaps vis-a-vis when we talk about providing nutrition to them, and that to the enteral nutrition. They have a relatively high caloric requirement due to sickness. They have a low energy and nutrient reserve because there is deficient nutritional stores, because they have come early, they have left the uterine environment early. So there is limited accretion of nutrients like glycogen, fat, calcium, phosphorus, iron, and others. Then they have immature kidneys. So their kidneys cannot concentrate the urine. So they need more fluid to excrete the solute load. Then they have an excessive evaporative fluid loss because they have a relatively larger head. Then they have a very thin skin, and the subcutaneous fat is missing. So the evaporative fluid loss is more, so they need more fluid and electrolytes. Then they have a small gastric capacity. So you cannot put larger aliquots at a particular feeding cycle. So you have to feed them frequently. Then they have a poor suck and swallow coordination. To swallow the feed provided to the baby should suck and then swallow it, and it should be coordinated, which appears at around 34 weeks of gestation. And babies who are less than 34 weeks, this coordination is missing. So then you cannot give spoon or cup feed, you have to resort to orogastric feeds. Then they have a poor gag reflex. and it increases their chances of getting the feed aspirated. So it becomes, if they aspirate the feed, then their respiratory, their respiration compromises, and they require support for that. Then they have an immature, incomplete esophageal sphincter. So they have greater chances of having gastroesophageal reflux, and that again compromises their the orogastric feeding. Then they have decreased enzymes, hormones, and bile acids, and all these things lead to imperfect digestion of nutrients which are provided to them enterally. These are the energy requirements of preterm infants. And when we calculate energy requirements, basically the preterm infants require around, they have a higher energy requirement, about 125 calories per kg per day, and they spend these 125 in these things. You can see that we have to make arrangement for cold stress 10%, and then growth comes later. But at the same time, this requirement also depends upon their age and weight and maturation. More immature the baby, requirement is more than caloric intake, growth rate, activity, thermal environment. If they are not kept in the thermoneutral environment, then the energy requirement increases, and nature of feeds. Preterm's own mother's milk given at 180 ml per kg per day provides adequate calories, because 100 ml contains about 65 to 67 calories. And if baby is receiving about 180 ml per kg per day, then this requirement can be met. These are the requirements of preterm infants. The macronutrients: protein, they require about 3.5 to 4.5 grams per kg per day. It's higher than what a term baby needs. Then carbohydrates about 10 to 14 grams per kg per day, and fat about 5 to 7 grams per kg per day. And this was this review published in PCNA in 2014, which looked into human milk for the premature infants, and they found, and you can see the this bold line is very preterm babies, the dashed line is preterm babies, and this round with circles is the full term babies. The you can see that protein in very preterm babies in the first week is it's almost around 3 grams per 100 ml per 100 per deciliter. I mean, it's a very high amount, and in comparison to, if you look at the protein present in the full term breast milk, it's about 2.2. So it's I mean, the because requirement of preterm baby is more, so preterm milk contains more protein. It's nature's way to help the preterm babies to sustain. Then fat is also high in and it increases till third week, and then it remains there till 8th week of life. Similarly, the lactose content also increases from first week to 8th week. It gradually increases. So we can say that the preterm milk, as preterm babies requirement increases, the nutrients content in breast milk also increases according to baby's need. Then the nutrients, they also have some specific features which really help preterm babies to in various ways. Carbohydrates, it's lactose, the 90% is absorbed even by low birth weight. Unabsorbed makes, and whatever 10% is not absorbed, it makes stools soft. Then they have a specific carbohydrate that is known oligosaccharides. It prevents bacterial colonization and necrotizing enterocolitis. Then the fats, they contain high amount of polyunsaturated fatty acids, medium chain triglyceride, carnitine, and inositol. They many of these things are required by the growing brain and the nervous system. Then proteins, the ratio is very helpful. The ratio of weight to casein is 70 to 30. The absorption is better. The lactalbumin is also easily digested, and the milk contains essential amino acids like taurine. So this was about the why we prefer. I mean, when we talk about breast milk, it's the from nutrient point of view, the breast milk is adequate. There are only few micronutrients like calcium, phosphorus, and iron, which needs supplementation, and that's a different topic. So I have not included them here. But when the all the major requirements of energy and macronutrients can be met with the preterm milk. Then we come to the second point, that what are the health benefits of breast milk to the preterm infants. When we talk about health benefits, there is decreased rates of late onset sepsis. A very, I mean, as neonatologists, we really worry about a newborn baby, a preterm baby going on smoothly, and in the after 72 hours, particularly in the second week of life, when all other things are settling down, the respiratory distress is settling down, the baby is getting better, and suddenly we find that the baby is now limp and not activity has gone down, not retaining feeds. And when we investigate, we find that the baby has got sepsis. Breast milk actually helps in preventing late onset sepsis. Then it helps in decreased rates of necrotizing enterocolitis. I will tell you how it is, how breast milk helps in it. Decreased rates of retinopathy of prematurity. Again, these two things are, we are really worried when we are dealing with the preterm babies. There are fewer rehospitalization in the first year of life. They after discharge, they really remain healthy. They do not get sick. Then improved neurodevelopmental outcome, lower rates of metabolic syndrome later in the life, and lower risk of hypertension later in the life. This is how breast milk helps in prevention of infections. Breast milk contains antimicrobial factors like secretory IgA, IgG, IgM, oligosaccharides, lysozyme, and leukocytes. Then they also contains cytokines and anti-inflammatory factors like interleukins, prostaglandins, and tissue necrosis factor. Whenever a mother gets infection, her body makes antibodies against that infection, and it is the it's when mother provides breast milk to baby, all the infections which mother got before pregnancy, the antibodies are there, and those antibodies, they are passed in the breast milk. It comes to baby and provide passive immunity. This was a systemic review and meta-analysis done recently published in 2020. They looked into the impact of human milk on necrotizing enterocolitis, and they found where they compared human milk versus formula. There was a significant benefit in favor of human milk. The relative risk was really, I mean, there is 2/3 less than in comparison to formula. The human milk versus mixed, even with the mixed feeding, when they compared the human milk, it went in favor of human milk. So when we say human milk, they included both mother's own milk and donated breast milk. This is how breast milk helps in prevention, because breast milk contains immunoglobulins, so lesser infections, the erythropoietin, IL-10, the epithelial growth factor. So if there is any injury to the gut mucosa, then this growth factor helps in repair of the intestinal mucosa, and thereby preventing entry of any microorganism into the bloodstream. Then they also have platelet activating factor acetyl hydrolase. It also helps in preventing, initiation of inflammatory response by keeping the platelets in check. Then breast milk oligosaccharides and glycoconjugate, they prevent intestinal attachment of entropathogens by acting as receptor homologues. So they attach to the intestinal epithelium, thereby the site is not available for the microorganism to attach there, and thereby infection is not there. Then the microbiota, the breastfed infants, they have a good intestinal microbiota like bifidobacteria, which predominates over the potentially harmful bacteria in comparison to formula-fed infant. which contains pathogenic organisms like coliform, enterococci, and bacteroids. Then this is something new which has come up, and this is about stem cells. This drop, you can see in this is a breast milk drop, and you can see all the cells which are available, which are present in the breast milk. You just see the green one, the progenitor and stem cells, and you can see that these stem cells with milk, they reach to the intestinal tract, and from the intestine they are absorbed. I mean, just track the green one, and then they populate the specific distant organ. I mean, stem cell related to brain goes to brain, and the stem cells related to lungs, they go to lungs. The stem cell related to liver goes to liver, and spleen to spleen, and bone marrow to bone marrow. So whenever there is any injury to these tissues, these stem cells actually helps in repairing those tissues. We know that in some tissues, like in some organs like brain, it can actually change the final outcome. I mean, if baby is receiving breast milk, and if brain stem cells are already there, then they will differentiate into the brain tissue, and it will help if there is an injury. I mean, repairing that injury. So more research is going on this issue, and in coming future, maybe we will have more studies available to us. So now we come to the third one, that is what needs to be done to enhance procurement of breast milk. I don't know why this red one is coming. Sorry for this line. I don't know how it has come. Yeah, procuring breast milk in the NICU. So what works? Talking to the mother and family is the real thing. I mean, mother should be counseled, the family should be counseled before delivery, immediately after delivery, and she should be asked to, I mean, clarify if there are any doubts about breast milk procurement or breastfeeding. And the I mean, expression should start within the first 24 hours if the mother's health permits. Then we also need to have staff training, because the staff needs to speak in one voice, and they should help the mothers and family, because we know that in initial 2, 3, 4 days, there may not be much milk available to us, but they should encourage they should remain positive and encourage the family to keep on expressing the milk, whatever milk is available, because we know that even a 1 ml of breast milk contains about 1 million cells. So even 1 million is good. I mean, if the family has brought 1 ml, don't discourage them. Say that you have done good. I mean, next time it will be more. Like with breastfeeding education and support, we've already talked about it, that how important it is. And while counseling the mother, parents, and family members, the staff can talk about crucial importance of breast milk to the preterm and the ill infant, keeping all the points in view, like the decreased infection, necrotizing enterocolitis, retinopathy of prematurity, improved neurological development, and long-term benefits of breastfeeding to babies and mothers. Then while talking about procurement, there are various methods, and these questions are frequently asked, how to do it actually. Should we do it manually, or should we use any pumps? So the NNF CPG 2020 guidelines, the guidelines on breast milk for preterm infant and neonates, went into all the available research published at that particular point of time. And we found, because I was the chair of this group who wrote these guidelines, and we went into all the available published reviews, the systematic reviews, the meta-analysis, the Cochrane reviews, and observational studies. And we found, we recommended these, that infants admitted in the neonatal units in the first week after delivery, either electric or manual breast pump to get higher volume of expressed breast milk. There are several studies. supporting this. And in the second week after delivery, manual breast pumps to do sequential expression, that is expression from one breast followed by that from the other. It should be done. But many times at many places we do not have in these pumps available. Then when we say that in the resource constraint settings, manual milk pumps and manual expression of milk may be used in place of electric pump. So if pumps are not available, then mother should be, and the family member, one of the female family members should be taught how to express the milk manually, and that should work. Then there are certain other methods by which breast milk production can be enhanced. There are certain low-cost care techniques like breast massage, breast warming, and relaxation technique like music therapy. There are studies available on these topics, and all of them have found that while using them, the production of milk, the increased significantly. I mean, in comparison to not using these methods. Then non-nutritive sucking by the baby, and it should be started early. It helps in quicker transition from gavage to full oral feeding. It also helps in transition from start of oral feeding to full oral feeding, and it also helps in decreasing the length of hospital stay. So it's really, really important. And of course, the kangaroo mother care, it's a full topic in itself. So, and we all know that kangaroo mother care in babies, if the mothers doing kangaroo mother care, the breastfeeding is better, the procurement of breast milk is more, babies' thermoregulation is better, and their hospital stay decreases. So kangaroo mother care also very, very important. So here I will stop with these carry home messages. That breast milk feeding or breastfeeding is preferred method to provide nutrition to the tiny preterm babies. There are no two questions about that. Breast milk provides crucial health benefits to sick and vulnerable preterm babies, and this is really very, very important to understand, because we all are always worried about the final, preventing morbidity and improving survival of preterm babies. They require a lot of resources in neonatal intensive care units. And when we say that survival, we are worried about intact survival of these babies. So no ROPs, no neurodevelopmental deficits, etc. And by using scientific methods, procurement of breast milk in the NICU can be enhanced. So all these are evidence-based. There should not be any question about all these things. The only thing is that we should buck up, we should improve our knowledge, our skills, and we should have better policies at our places and start implementing these things. Thank you very much.
Thank you very much, sir, for your comprehensive and holistic information about the breast feeding and about the breast milk. Thank you very much, sir. So now the stage is open for the discussion from the participants. Anybody wants to ask something, please leave your question in the chat box.
They can ask also the question, direct
Yeah.
question.
You can ask also. Any questions, any clarification?
Is there any question in chat box? You can then read.
I'm looking into it, but I don't find any question actually. No. If the mother, yeah, there is one question. If the mother was with HIV positive, can give breastfeed? Yes. Yeah. So it's a very good question actually. Mothers who are HIV positive, now the guidelines says, the global guidelines and Government of India has the NACO guidelines also, that all mothers, the pregnant and lactating mothers, they should receive antiretroviral drugs irrespective of their health condition, and they should provide breast milk for their babies. They should breastfeed their babies. The chances of transmission of HIV by using ARV and exclusive breastfeeding is only 1%. So earlier there were concerns because HIV, this organism is present in the breast milk. So they were in developing countries, it was prohibited. I mean, HIV positive mothers were not allowed to breastfeed. In our country, of course, we were doing, I mean, we never prohibited it. We always, the government of India guidelines always promoted exclusive breastfeeding. But now with the availability of better antiretroviral drugs, it's scientifically proven, and now it's very safe, and all the babies, they can be breastfed. Yes.
Okay, thank you, Dr. Dadish. The next question is like how much from Jyoti Sangwan, how much breastfeeding given in 24 hours? So Jyoti, how much or how many times you want to know about? How much breastfeeding given in 24 hours? It's from Jyoti Sangwan. Jyoti, are you there?
Okay. Probably she's asking how many times actually.
Times, yes, sir.
Yeah. So basically, when we talk about term babies, we say it should be on demand. So there should be at least 8 to 10 feeds in 24 hours. So every 2.5 hours to 3 hours, baby usually they require, and it's a demand feeding. So baby himself or herself is saying that I am hungry. The caregiver should be, I mean, they should know the hunger cues when baby is hungry, and they should breastfeed. The mother should breastfeed on the early hunger cues. So basically, I mean, 8 times on an average, baby requires feeding in 24 hours. Yes.
There was some question on hepatitis B. Somebody.
Yes, sir. Same like it's hepatitis B. Can the hepatitis B can we initiate breastfeeding?
Yes. Yeah. 2-3 days back, actually, there was a webinar organized by Indian Academy of Pediatrics IYCF chapter, and this was the topic given to me: the infectious diseases in mother and breastfeeding. And there also we discussed about the hepatitis B mothers. Of course, mothers having hepatitis B, they can breastfeed their babies with some precautions, like the baby should be given the hepatitis B vaccine at birth, and the hepatitis B immunoglobulin within 12 hours of birth. But breastfeeding can be started, I mean, early initiation can be done within 12 hours. The vaccine and the antibodies, these immunoglobulin should be given to the baby. So it's perfectly okay for those mothers, they breastfeed.
So, sir, we have a very good question. I mean to say, somebody asked that Radha Krishna, she has asked that, sir, any recent updation in monkeypox and breastfeeding?
Well, I'm not sure about monkeypox now at this particular moment, but as I understand, there are skin lesions in monkeypox.
Yes,
and if we compare it with the chickenpox, where also again, and herpes simplex, again we have skin lesions. So there we recommend that if mother covers the skin and if there are no lesions in the mucous membranes, then those mothers can breastfeed. But I'm not very sure about monkeypox. I have to read about this.
no, sir, it's a very recent, and just monkeypox just started, so a lot of research has to be done. Sir, we have one more question that, sir, what to do if after the C-section of mother and mother's milk is not produced? Then how to feed the newborn?
Yeah. This is a real challenge actually in hospitals. And when we say that the initiation is very low in our hospitals, this is one group in which universally the initiation is delayed. But we should, I mean, there is no need, there is no difference in milk production based on the type of delivery actually. The milk, the physiology of milk production remains same in normal delivery as well as in the cesarean section. We all know that when there is suckling, the prolactin is secreted by pituitary, the prolactin comes to the breast, and then milk is secreted from there. This mechanism remains same in both the normal delivery as well as in the cesarean. Similarly, the oxytocin reflex, when suckling happens, the oxytocin is released from the posterior pituitary, it comes to the breast, and whatever milk is there, it is pushed forwards, that is the let down reflex. This mechanism also remains same in normal delivery as well as in the cesarean delivery. The only thing is that after cesarean deliveries at many places, baby and mother are separated. So if they are kept together, then they can very well be, I mean, baby can be put on the breast. Of course, the family members or the healthcare providers, they have to help the mother to put the baby on the breast. So there is no need. I mean, if mother is in lying in the supine position, then there are methods of doing it, and there are videos also available to this. And if somebody is interested in knowing more about it, I can send more, I mean, videos and all those things to them. They can, I will put my email address here, so I will send them. But of course, yes, it is possible to do it, just like we do it in the normal delivery. Because the suckling has to be done by baby. Baby is okay. I mean, there is no problem in baby. So when suckling is done by baby, automatically the prolactin oxytocin reflex will start doing their work. Milk will be available, just like to a baby with the normal delivery.
Thank you, sir. Sir, one more question we have, like a lot of questions are there. So, Pushpa L, she has asked that. So, how long the expressed breast milk can be kept for feeding?
Yeah, if we keep the expressed breast milk at home, then at room temperature, then we can keep it for 6 to 8 hours without getting it spoiled. Where if we keep it in the fridge, then we can keep it for 24 hours. So when we say that keep it in fridge, then it should be kept in the first compartment of the fridge, just below the freezer. It should not be kept in the on the door, in the door. I mean, there the temperature is low, on the high, but just below the freezer, the first compartment, the breast milk should be kept there, and we can keep it breast milk there safely for 24 hours.
Okay. Okay, sir. So I'm taking this last question, and the question is about what about mother with COVID positive?
Yeah.
I think he wants to know about he or she. He wants to know about that whether COVID positive mother can breastfeed or not.
Yes. So yes, mother with COVID positive also can breastfeed. Only thing is that she has to take certain precautions, because now enough research is available, and they have looked into the breast milk of all COVID positive mothers, and there are several published studies, and they did not find any disease causing virus in breast milk. So unlike the HIV, the virus is present in the breast milk. In COVID-19, the breast milk doesn't contain the virus. So breast milk is safe. But at the same time, mother can, I mean, with the contact, just like the COVID-19 spreads with contact. So this can, I mean, the baby may get infection from anybody in the family who is infected. It's not specific to mother. I mean, if somebody else is also infected, then baby can get it. So all those who are affected with the COVID-19 in the family, they should use the prevention and control measures like wearing a mask all the time, and washing their hands, and using sanitizer, and cleaning the frequently touched surface with sanitizer. All these precautions are to be taken, particularly when baby is being handled. So if these precautions are taken, then a mother with COVID-19 can very well breastfeed safely. And these are global guidelines. These are guidelines by WHO, UNICEF. These are guidelines by Government of India also, the Ministry of Health. So and these are guidelines by Indian Academy of Pediatrics, NNF, and FOXI also. So it's really safe. Moreover, the COVID-19 positive mother, on one hand, the virus is not there in the breast milk. On the other hand, the antibodies are there. I mean, I just, as I told you in one of the slides, that whenever a mother gets infection, antibodies are formed against that particular infection in the body, and those antibodies are transferred in the breast milk to the baby. So that is true for COVID-19 also. So in mother's milk, there are several studies, they found antibodies against COVID-19 in breast milk. So adults, they started getting their vaccine in January 2021, but babies, they were being fed with breast milk and they were getting passive immunity even before that. So that is the advantage of breastfeeding. And after the pregnant and lactating mothers, they started getting vaccines, COVID-19 vaccine. They started getting it later on. I mean, initially they were not allowed to get it, but later on they started getting it. And then there were studies, they found that after vaccine, again, the antibodies were there in the breast milk and they were providing passive immunity to the baby. Yes. So it's beneficial actually.
Ma'am, can we take one or two more questions, or shall we move? Okay. So one more question is there, sir. So they are telling, can we keep the milk in room temperature? And if we have kept the milk in room temperature after 4 to 5 hours, is it necessary to warm it or directly can we feed?
No, there is no need to warm it. Yeah. And because it's already at room temperature, you can directly feed. There is no need.
Okay. Okay. Thank you so very much, sir. So,
sir, there is one participant. Sorry, sir. There is one participant who is raising hand. Mr.
okay.
Bhagwan Sahai Prajapati. Yeah.
Okay, Bhagwan Sahai, can you unmute yourself?
If you want to ask something, yes. And there is one more question regarding cleaning of the breast every time before breastfeeding. Do we need to clean the breast?
I have missed. Sir, this
Yeah.
question is for you, sir.
No, there is no need. I mean, it's not required. Rather,
Sir,
it's detrimental, because if you keep on, because the areola and nipple, they contain a lubricating agents being secreted there by certain glands. And if you keep on cleaning the breast, then you are removing that protective layer from those tissues. These are very sensitive tissues, and if there is any soreness, then it will be very painful for the mother to breastfeed actually. So every time there is no need to clean it. Yes, of course, to keep the hygiene, mother should take bath every day, and that is sufficient.
okay, thank you, sir. Sir, I have a question, if time permits.
Please.
Okay, so there is a recent concept of milk bank, sir, coming. So in that, how long the breast milk can be stored?
Yeah, they can store even up to 6 months actually, because they are keeping it in the deep freezer. They are keeping the milk at -20 degrees centigrade.
Okay.
So basically they are storing the milk, and there is a whole process of doing it. They pasteurize and then
So how to use that milk, sir, after we need to thaw the milk?
Yes. So once the milk is to be used, then it has to be taken out from the deep freezer, and then it is to be thawed, and there is the whole process of doing it, and then it should be given.
And one of my participants, we also conduct many trainings. So one of the participant has asked a question, like if they are feeding, suppose bottle feeding the express milk or spoon feeding, and they are left with some milk. So can we use that milk that is left over?
If it is mother's own milk, then if you think that it's within the time limit, then of course, and if it is to be used for the same baby, then of course it can be used. Yes.
So time limit is 2 hours or 6 hours?
No, because you are keeping the milk at room temperature. Okay.
Yes.
And if it is within 6 to 8 hours, and if we are giving the next feed which falls within 6 to 8 hours, then you can use it. Yes.
Okay. Thank you so much.
Not like formula, because which gets spoiled within half an hour. Do you know why it gets spoiled? The formula. And you will be surprised to know that the powdered infant formula is not a sterile product. It's not written on the dibba, but it's not a sterile product. It contains spores of different bacteria, and most important are the salmonella and Enterobacter sakazaki. These two are pathogenic organisms whose spores may be there in the powdered infant formula. And if you prepare the formula and keep it for half an hour, then these spores they grow into bacteria, the real bacteria. And if that particular feed is given to a baby, then that baby may become sick. So, and this process is not there in breastfeeding. So maybe some nutrients will go down, but the organism will not be there. Yes.
Thank you so much, sir.
So
So there
Bhagwan Sahai, yeah, Bhagwan Sahai, you have raised your hand. Do you want to ask something? Okay, Lakshmi Shah, HD. She has a question, sir. Let me read for you. Sir, as you said, we can store mother's milk in milk bank for 6 months. Will there be any depletion in nutritive value?
Yes, yeah. There is some depletion, but more or less I mean, the macronutrients, they remain same, but some micronutrients, they go down. Yes.
Okay. Okay, Bhagwan Sahai, you can ask your question.
No, sir. No. Thank you, sir.
Okay, go ahead.
No, he's not asking any question. He's saying no, sir.
Okay. So you have raised your hand. Okay, no problem. So we will move to the next speaker. Ma'am, unmute yourself, ma'am. PT ma'am, please unmute yourself.
Necro and enterocolites, somebody was asking.
Okay.
Yes, yeah, I will answer this. Yes. Yes, in necrotizing enterocolitis, when we say necrotizing enterocolitis, there are different stages of this, and stage 1, 2, and 3, basically. And for each stage, we need to keep the baby, the stomach. We need to give rest to baby's gastrointestinal tract, depending on the stage of the disease. But after that, when we start enteral feeds, we can very well give breast milk. Yes. Rather, it is preferred. Rather, yes.
Dr. Dadij, I just want to know, you are talking about breastfeeding in when the mother is COVID positive, and are there any specific guidelines that what is the procedure that time, how breastfeed can be given, whether it has to be
Yes.
expressed or whether the baby, because we cannot keep the baby in contact with the mother despite the breast milk does not contain the virus.
No, now the guideline says that baby should be nursed in the same room. Actually, they should be kept together. Rooming in should be practiced. These are Government of India's guidelines now. So if you, I mean, I will send the guidelines to you, and the whole. I mean,
but now there's a different variant and it's not so grave. During the grave times when second wave.
These guidelines came in April, May 2020 actually, and they have not changed them.
Okay.
So it applies to all the variants. Yeah.
Okay. Okay, Pawan.
Sir, somebody has asked that when mother is suffering from mastitis, can mother feed the baby?
Yeah, it's a good question. I mean, we are going into deeper things now, but yes, yeah. But the condition itself, the mastitis, is very painful for the mother. But the dictum is that give rest to the baby, don't give rest to the breast, because emptying the breast is part of the treatment actually. So even if mother can't breastfeed directly, the breast should be emptied actually by expressing the milk, and that expressed breast milk can be given to the baby, because mastitis, they will be only in only one part of the breast, and the from another breast, because it will never happen in both the breasts. So the other breast is okay, so breastfeed can be given from the other breast. Because when we say prolactin reflex and oxytocin reflex, with the stimulus is only on one breast, but hormone will go to both the breasts. the milk production will be in both the breasts. The milk let down will be in both the breasts. I mean, the other breast is okay. So breastfeeding, direct breastfeeding can be done from the unaffected breast, and from the affected breast, it should be emptied. Otherwise, mastitis will not be, mother will not be relieved of the symptoms. So yeah.
Thank you, sir. So we will move to our next speaker. So, okay, sir. Thank you very much, sir. So patiently you have answered all the questions from all the participants, and thank you very much for supporting.
Thank you.
So moving to our next speaker. So let me share my screen. So our next speaker is Dr. Impal Sharma, Associate Professor, College of Nursing, All India Institute of Medical Sciences, New Delhi. So Dr. Sharma, as I have said, presently working in AIIMS, New Delhi. And Dr. Sharma, so Dr. Sharma authored a textbook of pediatric nursing, that is essential of pediatric nursing, with JP Brother, and she is having experience more than 16 years in supervision, clinical care, teaching postgraduate and undergraduate students, and guiding.
Please,
she has also authored she has also authored all of the participants. Please mute yourself. She has also authored a textbook, drug book for nurses, and she is a regional trainer for neonatal resuscitation program of NNF and Indian Academy of Pediatrics. She is a certified pediatric advanced life support instructor trained from American Heart Association in collaboration with Indian Society of Emergency and Cardiac Nursing. She is also a certified level 3.
You're calling the mother on phone. You don't even know if it's the mother you're calling the phone. You can arrange one girl in there.
Pawan, kindly ask the participants to mute.
All participants, please mute yourself. All participants.
Please mute yourself.
Ma'am, I will mute everybody, ma'am. Just give me.
Okay, you mute yourself.
A very good morning to Professor Dr. Pettikal.
Ek minute, just let me finish. Dr. Impal, just let me finish. Okay, she's also a certified level 3 simulation trainer associated with Pediastar India. She has participated resource person and panelist in various national and state level workshops and conferences. She has publications in national and international journals and holding memberships of many professional body. So I invite Dr. Impal Sharma for explain her topic, please. Over to Dr. Impal Sharma.
A very good morning to Professor Dr. Pettikal, President NTAI Delhi chapter, Professor Farooq, President NTAI National NTAI, Dr. Rawat, President PNNFI, our esteemed guest Dr. JP Dadish, and all the executives of NTAI Delhi chapter along with the participants. Firstly, I would like to thank Professor Dr. Pettikal for giving me this opportunity to talk on the topic which is very close to my heart. So thank you, ma'am, for this opportunity. So I would be talking on the newer initiatives to promote breastfeeding. I'll share my screen.
Dr. Impal, now you can share. I have make you co-host.
I'll share my screen.
Start slide.
So is it visible? So I'll be talking about the newer initiatives to promote breastfeeding in India.
Dr. Sharma, please start the slideshow.
I've already started.
But it's not showing. Okay, you continue.
As Dr. Dadich has already given a very elaborate introduction about the topic, so I'll pick up from there. So breastfeeding is one of the most effective ways to ensure child health and survival. However, nearly 2 out of 3 infants are not exclusively breastfed for the recommended 6 months, a rate that has not improved in 2 decades. So though we know that breastfeeding is very important and every infant should be exclusively breastfed for 6 months, but even then, even after knowing or having sufficient knowledge, we are not able to attain higher levels of exclusive breastfeeding by infants. Coming to some key factors, every infant and child has the right to good nutrition according to the Convention on the Rights of the Child. And undernutrition is associated with around 45% of child deaths. Globally, in 2020, 149 million children under
Your
5.
slides are not showing. They are not changing. Slides.
I'll
now
share it again.
Okay, it has now started. Okay.
Is it visible now?
Yeah.
So globally in 2020, 149 million children under 5 were estimated to be stunted. That means they were too short for age. And 45 million were estimated to be wasted. That means they were too thin for their height. And 38.9 million were overweight or obese. That means this shows a global scenario of malnutrition in children. And only about 44% of infants between 0 to 6 months old were exclusively breastfed. Coming to a few more facts, few children receive nutritionally adequate and safe complementary foods. In many countries, less than a fourth of infants, 6 to 23 months of age, meets the criteria of dietary diversity and feeding frequency that are appropriate for their age. Over 8,20,000 children's lives could be saved every year among children under 5 years if all children who are between 0 to 23 months were optimally breastfed. Breastfeeding improves the IQ, school attendance by reducing the risk of infection, and is associated with higher income in adult lives because these infants who grow and who had received proper breastfeeding, they grow into really healthy, smart, intelligent youth who can earn well and have a good livelihood. Improving child development and reducing health costs through breastfeeding results in economic gain for individual families as well as at the national level. So these are the various advantages of breastfeeding or the facts which are associated with exclusive breastfeeding. Talking about the initiatives to promote breastfeeding, one of the initiatives is the BPNI, that is Breastfeeding Promotion Network of India. The BPNI was founded on 3rd December 1991 at Wardha, Maharashtra. The BPNI is a registered independent non-profit national organization working towards protecting, promoting and supporting breastfeeding and appropriate complementary feeding of infant and young children. The BPNI acts on the target of Innocenti Declarations, Convention on the Rights of the Child, International Code of Marketing of Breast Milk Substitutes, and the Global Strategy for Infant and Young Child Feeding. BPNI's core area of work includes policy advocacy to educate policymakers and managers, training of health workers, capacity building of state governments for implementing the policy, social mobilization during World Breastfeeding Week each year, and monitoring compliance with the Infant Milk Substitute, Feeding Bottle and Infant Food Act of 1992, which was amended in 2003. So BPNI plays a major role in promoting breastfeeding in India. BPNI is the one that initiated the Breastfeeding Hospital Initiative Accreditation Program. And this was again reviewed on 13th July 2022. The objective of the program was to improve early breastfeeding rates in the hospitals with maternity services, with special focus on the private hospitals. And the focus of BFHI was on both normal and cesarean section births. That means on both the on babies born by normal delivery or by cesarean section, breastfeeding has to be initiated within 1 hour of birth. Earlier, it was a norm that in normal deliveries, breastfeeding has to be initiated within half an hour, and for cesarean section, it was to be initiated within 1 hour of birth or as soon as the mother can feed. But now, as per the newer guidelines, for the babies born by normal delivery or by cesarean section, breastfeeding has to be initiated within 1 hour of birth. According to the NFHS 4 and NFHS 5, the current status of breastfeeding practices, it can be seen that early breastfeeding is seen only in 41.6% and 41.4% of infants. As per NFHS 5, exclusive breastfeeding percentage is just 54.9%, and NFHS 5 shows that exclusive breastfeeding percentage is just 63.7. So we are yet to cover a long way to attain at least 90 to 95% exclusive breastfeeding rates and early breastfeeding initiation rates in India. The supporting partners for this initiative of breastfeeding support. So these are the various supporting partners. The early initiation of breastfeeding and exclusive breastfeeding is supported by the IAP Nutrition Chapter, the UNICEF, the National Neonatology Forum, the Epidemiology Foundation of India, the Trained Nurses Association of India, and the Indian Medical Association. So all these are the supporting partners who are supporting early initiation as well as exclusive breastfeeding in India. Coming to the development process of the tools for assessment and accreditation, as I told you that BPNI has taken the initiative of promoting baby-friendly hospital initiative in India. So in 2019, they conducted a meeting where tools for assessment and development under the Government of India's Technical Action Support Group that was chaired by the Child Health Commissioner of Government of India was there. And along with WHO, BPNI and Government of India, UNICEF, and the various experts who were there in the Technical Action Support Group, they together formulated the various tools which can be used for accreditation of baby-friendly hospitals. This is the kind of certificate which is given to those hospitals which fulfill or they comply with the breastfeeding hospital initiative policy and who adhere to it. Now, what is the benefit of getting accreditation of BFHI? So there are various benefits for the mothers and the babies along with the hospital as well as community. So if a hospital is baby friendly accredited, what is the benefit for the mothers? The mothers will get the highest quality of care and best quality of nutrition will be given to the baby at the very start of their life. For the hospitals, so if the hospital is accredited, it
Excuse me, ma'am.
continues. Yes.
Ma'am, your slides are not moving. Can you just restart slideshow? Yeah.
Is the certificate grade 1 visible?
We are seeing your BPNI, Breastfeeding Promotion Network of
BPNI?
India. Yes, ma'am.
Is it this one? BPNI.
Yes, ma'am. BPNI. That slide is
Okay.
only visible. It's not moving, ma'am.
Just a minute. I'll put it on slideshow again.
Yes, ma'am. Now it's moving. Yeah. Can you put it on slideshow?
Yeah. Is it visible now? Benefits of accreditation?
Yes, ma'am. It's visible, but it is not on slideshow mode.
Ma'am, please select the current slideshow, then it will move accordingly. The current slideshow.
Is it visible now?
Ma'am, please select the current slideshow with the third one, third button. Okay, yes, ma'am. Yes, ma'am.
Okay. So we were talking about the benefits of getting baby-friendly hospital initiative accreditation. So there are various benefits which are there for the mother, for the baby, the hospital, as well as for the community. So talking about the benefit for the mother, if a mother is admitted in a hospital, which is a baby-friendly hospital initiative accredited, then the mother is more likely to get highest quality of care. And the benefit for baby is that the baby will be getting highest quality of nutrition at the very start of the life. The benefit for the hospital is that accreditation stimulates continuous improvement to the benchmark with the best, and it enables the hospital to demonstrate its commitment to quality care and raises the community's confidence in its services. So we can assume, like, if a hospital is BFHI accredited, then we are more likely to get best possible care there. The benefit for the hospital staff is that accreditation provides hospital staff with continuous learning, leadership, and ownership of processes. It improves the professional development of all staff and stimulates quality improvement. So all this is helpful in marketing. So this is how the hospital is also benefited if it is accredited with BFHI. Another initiative of the BPNI is that they have launched a web platform on which the hospitals can apply for the accreditation. Firstly, they have to register, comply with the policy of the initiative, and then they can go for the accreditation. The BPNI has launched another initiative, which is a digital platform for educating pregnant women. It is known as I Decide. I Decide is an initiative which is this is a platform for the mothers which helps them in giving adequate knowledge so that they can make decision about feeding of their babies. It is a paid platform which has a very nominal fee, like just $2.99. The mother needs to pay this registration fee, sign up on the platform, and she will be given adequate knowledge and support in order to breastfeed her baby. And if at all there are some issues due to which she cannot breastfeed, then she will be guided on how to feed the baby adequately. So this is a newer initiative which is launched by the BPNI, which is known as I Decide. The World Breastfeeding Protection Day is another initiative. This is celebrated on the 21st of May, and this initiative, this is a newer initiative which again promotes and propagates the norm of exclusive breastfeeding. There is another initiative by the Government of India and the BPNI known as the Stanpan Suraksha mobile app. So this app is for both the Android phones as well as for Apple. It is available on Google Play as well as Apple Store. This app can be safely downloaded by the pregnant ladies. They will be registered on it and they will be supported. They'll get adequate support and instructions regarding exclusive breastfeeding of the babies and how they can handle the complications which are associated with breastfeeding or the problems which may hinder exclusive breastfeeding. This is also a very good app and a very good initiative by the BPNI. Another initiative to support exclusive breastfeeding is the Infant Milk Substitute, Feeding Bottles and Infant Food Amendment Act. This was the act which was initially launched in 1992, but then it was amended in 2003. And again, it has been reinforced, like in 2020, a meeting was held at the ministry level and it was decided to strictly apply this act and to follow this act, and strict actions need to be taken against any violators who are violating the act in state. So the act came into existence after the 1981, where the World Health Assembly adopted the code, the international code for supporting of the breastfeeding. So after the act, so this act was implemented in various countries, and India is one of the signatory members to it. So India enacted this law in 1992. It came into enforcement on 1st of August as a central government law by the notification in the official gazette to protect, promote, and support breastfeeding. It was strengthened by an amendment in 2003, enhancing the protection level. Then the various rules were prescribed in 1993 and they were amended in 2003. So why this act came into existence? Because it was seen that inadequate breastfeeding leads to various problems like diarrhea, pneumonia, obesity, breast cancer in ladies, ovarian cancer in females, and an increase in the incidence of type 2 diabetes. Also, it was seen that there are around 1 lakh deaths, child deaths, which are preventable. So that is why this act came into existence, in order to suppress all these and control the child deaths. It was seen that after the act came into existence, the sale of ready-made food for infants was controlled. The orange bars, they are showing the amount of breastfeeding substitute or the powder milk or the infant formulas being supplied or being sold in China. And the green bars, they show the infant milk substitutes being supplied or being consumed in India. So as we can see, that
Excuse
very
me,
less.
ma'am, still the slides are not moving. Ma'am, you can skip the slide, should move. Yeah, like that only it is moving. Yeah. Okay.
Is it visible now?
No, yes, ma'am. Now it's visible. Yes.
Okay. So as I was telling about this slide, so we can see that the yellow bars, they show the infant milk substitutes being sold in China. We can see that such high is the consumption of infant milk substitutes in China, whereas it is quite low in India. So this is all, we can attribute this to the IMS Act, which is applicable or which is being complied in India. The section 3 of this act bans the promotion and advertisement of infant milk substitutes to the public. So it is not allowed to publicize formula feeds and infant milk substitutes on televisions or in newspapers. The section 4 of the act prohibits giving of incentives like some free products along with the infant milk substitute packets. The section 5 of the act restricts donation of products, educational material or equipments to various centers or hospitals. The section 6 of the act prescribes guidelines for labeling, and it is like the infant formulas or the milk substitutes, they have to have mandatory information on the labels, and it is important to prohibit picture of a baby, of mother or graphics to the substitutes. The section 7 ensures accurate information through educational material. The information has to be like supplied, provided, so that everybody has access to it. Section 8 bans promotions and display of infant milk substitutes in hospitals, clinics, and chemist shops. The section 9 prohibits contribution and pecuniary benefits to healthcare workers and their associates. It is not at all allowed to publicize these products amongst healthcare workers. The section 10 bans any sort of commission on the sale of these products. No healthcare provider can take commission on the sale of such products. Now, these are the various employees who are taking care that the IMA Act is taken care of and it is complied with well in the country. The food safety officers who are authorized class 1 government employees, the voluntary organizations notified by Government of India like the BPNI, the Association of Consumer Action on Safety and Health, the Indian Council for Child Welfare, and the Central Social Welfare Board. So these are the organization and class of employees who are taking care that the IMA Act is complied to in the country. There are criminal procedures that apply in the IMS Act. The section 23 says that an offense punishable under the IMS Act is bailable and cognizable. So if any of the sections of the Act are violated, then the person is or the institution is liable to get punishment. So the BPNI is authorized by Government of India to monitor that the IMS is complied in India. The FSSAI, which is advisory for the compliance with IMS Act. So the FSSAI issued an advisory stating that strict compliance has to be there for the IMS Act in India. The BPNI assists the Government of India in ongoing monitoring of the IMS Act, capacity building and awareness generation, along with documentation and reporting, technical assistance and legal action if in case the act is violated by any agency or by any individual or by any healthcare provider. Few other government actions that I would like to highlight here are: in August 2019, the Government of India wrote a letter or sent a letter to the ICMR stating that the company Nestle, which was trying to promote its infant food products, has to be issued a warning letter that the company cannot promote the products, especially in healthcare settings. Another initiative by the government was that ICMR took action and a letter was wrote back to the Nestle company that it cannot promote its products in healthcare setups. Also, the promotion in form of advertisements was taken care of. The Secretary Health writes to the state governments in September 2019 against Nestle company and other such companies which market the products or which produce the products, infant feeding substitute products. Like these products cannot be marketed and cannot be supplied openly in healthcare settings. The state government has taken various actions on such companies. It was also publicized, the mass media came and they participated in highlighting the government's initiative on banning these healthcare products, on these infant feeding products. So I was also talking, I already explained about this app, which was an initiative by the BPNI, the Stanpan Suraksha app. So conclusion about this act, the act empowers the government to take potential actions to protect breastfeeding from aggressive promotional activities of formula industry. Violation of the IMS Act continues. Even then, the country has the power to take action against agencies which violate the Act. And enforcement of the IMS Act needs more focus and efforts. The MA is another initiative of the Government of India. It is a program which was recently launched for the promotion of breastfeeding. MA stands for Mother's Absolute Affection, and we all know that breastfeeding is the best way where the mother can show her affection towards the baby. So this was the name given to the program, which was recently launched by the Ministry of Health and Family Welfare in order to promote breastfeeding. So countrywide intensified breastfeeding promotion campaign was the target of this program, and all the states and union territories were targeted. Around 3.9 crore pregnant and lactating mothers were the target. 8.8 lakh ashas were trained. 1.5 lakh sub-centers were taken into account or they were covered, and around 17,000 birthing facilities or delivery points were covered by the MA program. So talking about the program, it is an intensified program which was proposed to be launched in the month of August 2016, and it was launched in 2016 in an attempt to bring undiluted focus on promotion of breastfeeding, in addition to ongoing efforts through the health systems. This was called as MA. The program was launched on 5th August 2016 in various states and union territories. And this was a national level launch. The goal and objectives of the program were strictly to enable environment for breastfeeding through awareness generation activities, targeting pregnant and lactating mothers, family members, and society in order to promote optimal breastfeeding practices, reinforce lactational support services at public health facilities, and intensify and recognize those health facilities that show high rates of breastfeeding along with the processes in place for lactation management. So these were the goals and objectives of the program. Coming to the components of the program, like how the MA program actually gave a way, or it paved a way for effective breastfeeding in the country. It worked through 4 ways. Firstly was awareness generation. Secondly, by community level interventions. Thirdly, by facilitating the health facility strengthening. And fourthly, by monitoring the implementation of the program. So coming to the various activities which were a part of the MA program. The first activity was awareness generation by mass media support. So the Ministry of Health and Family Welfare developed branded audiovisual material with Madhuri Dixit as the celebrity advocate for wider publicity. Audio spots were aired, and they are aired till now on the Prasar Bharati. Newspaper advertisements are published in national dailies at a decided frequency. Bulk SMSs and voice messages are sent using the MCTS and the Kilkari scheme. The state and district plan launch of AV aid in month of August, and advocacy activities are planned with professional bodies of private sector like the Indian Medical Association, the Indian Academy of Pediatrics, and the Federation of Gynecological Society of India. Then another initiative was, or the activity taken under by the MA program was awareness generation at community level. So the Ashas and Anganwadi workers, they are mobilizing the community for advocacy on breastfeeding, along with support and counseling for optimal infant and young child feeding practices. The Ashas promote breastfeeding at community level and also counsel the mothers on management of breast engorgement and inverted nipples. The Ashas, they also take help from people who are associated with the mothers, like the husbands, the mother-in-law, and the entire family is roped in so as to facilitate breastfeeding of the newborn in the family. Cases requiring further help are referred to sub-centers, and skilled ANMs, and they are the ones who deal with such cases at the sub-centers. Then breastfeeding counseling is done during the village health and nutrition days and routine immunization sessions. So the village health and nutrition day is another initiative which is under the MA program, and it is the day which is celebrated in various villages on fixed day, like the 9th of every month. The day is celebrated, and the people who are participating in it, especially the mothers, they are counseled for exclusive breastfeeding. The community level interventions under the MA program include one-day sensitization of the ASHA to develop them as first information link on breastfeeding in the community. The ASHAs conduct meetings with mothers to promote, protect, manage, and support breastfeeding and complementary feeding. The ANMs are oriented to one-day mass sensitization module, and breastfeeding support groups are formed in the villages later on. So the ASHAs and the ANMs are the ones who are working at the community level to sensitize people and help the mothers in conducting breastfeeding exclusively. Another initiative was capacity building of healthcare providers. So one-day sensitization program using the mass sensitization module along with orientation to roles and responsibilities is undertaken in the August of every month, because August is the month where breastfeeding support group, breastfeeding week is celebrated every year. The process of preparing pool of master trainers continues by involving pediatrics, and the Preventive and Social Medicine Department of medical colleges. Then the master trainers are there who will in turn provide training to the medical officers, staff nurses, and ANMs of other centers. So this is how capacity is being built among healthcare providers. These healthcare providers who are empowered will help in supporting and empowering the mothers for continuing exclusive breastfeeding. Another initiative or another aspect of the MA is facility strengthening. So all the delivery points are equipped with necessary information and education and communication material on breastfeeding. So wherever the mothers, the antenatal clinics, the postnatal clinics, the labor rooms, the under 5 clinics, all these points where the mothers are more likely to spend their time, all these centers, all these rooms are to be having the IEC material which provides necessary information regarding breastfeeding to the mothers. So at all healthcare facilities, a dedicated space or room is being provided nowadays where the mother can breastfeed the child in privacy. Also, a National Resource Center is established at the Department of Pediatrics under the University College of Medical Sciences, New Delhi, in technical collaboration with the UNICEF and the BPNI. So this center will guide the states and support development of trainers for the state. Award and recognition for best performing baby friendly initiatives or baby friendly facility. So under the MA program, one MA award per district is given to best facility meeting the criteria for the award. A team cash award of around 10,000 rupees per facility is provided, which is shared by the ANMs, the staff nurses and the doctors. So this serves as an incentive for the facilities so that they can do or they can provide best possible care to the mothers and propagate this norm of exclusive breastfeeding. So coming to the conclusion, breastfeeding is one of the most effective ways to ensure child health and survival. Demand generation activities complemented with counseling and skilled lactation support and management services are the cornerstone for improving breastfeeding rates. And the government of India is taking all possible steps and has launched so many initiatives to propagate and help save the practice of exclusive breastfeeding. Thank you so much for patient listening. I'll be happy to answer if there are any questions.
Okay, thank you very much, Dr. Sharma, for enlightening us various laws and new initiative by Government of India. So now the participants, if they have any doubt, any clarification, you can ask the question or you can put your questions in the chat box. Rajkumari, you have raised your hand. Do you want to ask something? Waiting for the questions. Ma'am, if there is, okay. So now we are getting some questions.
You can go ahead then.
Yes, ma'am. So Jyoti Sangwan, she has asked that if you have Please summarize the Act 2016 outside milk. I'm exactly, the question is not clear. Dr. Sharma, is it clear to you?
Can you please repeat the question?
The
Participant can unmute and ask.
Jyoti.
Because on my screen I can see questions regarding express breast milk and all.
Okay, somebody has asked that kindly explain on Mamta Clinic.
The Mamta clinics are actually, it is not nationwide, it is a state specific initiative. So the places where we have the well baby clinics and the under 5 clinics, the immunization clinics. So to these clinics and the antenatal clinics, the Mamta clinics have been attached. The Mamta clinics, they basically focus on giving health talk and support to the mothers for breastfeeding. So there also the healthcare providers, they counsel the mother regarding the breastfeeding and immunization and how to take care of the child who is under 5 years of age. So it's a kind of like under 5 clinic, but it is an state specific initiative.
Then somebody has asked, when did MA established?
MA was launched actually in 2016. It was launched in 2016 and it has been continuing since then. And the basic focus of the program was to strengthen the act so that infant milk substitutes are not easily accessible, they are not publicized, and the mothers do not consider them as the main food for the infants. So MA is basically working at grassroots level, at the village level, to strengthen the healthcare workers over there, especially the ASHAs and the ANMs, so that they are empowered and they can counsel the mothers and establish and help in the establishment of breastfeeding support groups. So if breastfeeding support groups are there in the villages, the mothers can be made a part of it, and it's like very easy for them to discuss their problems, and then they get motivated also once they participate in these groups. So that was the focus, and with that intention, the MA program was launched.
Okay, if there are no questions, so can we proceed further?
You can proceed further.
Okay, Dr. Sharma, please stop sharing your screen. Okay, now as we have completed, okay, somebody asked something. Okay, so this is the last question I'm taking. So as ma'am said, in new policy within 1 hour initiate the breastfeeding by both normal delivery and CS mothers. Any changes of initiate breastfeeding in BFHI?
Yes, I would be happy to answer that question. So the baby friendly hospital initiative policy actually it never mentioned about the time when breastfeeding has to be initiated. So it never mentioned about the time when breastfeeding had to be initiated. The BFHI just gave 10 steps which were to be followed by the healthcare settings. And if they are complying with those of the 10 points which were there in the policy, then they were accredited as baby friendly settings. But it never told like how to or when to start breastfeeding. Exclusive breastfeeding was one of the points which is there in the policy, but it never mentioned about the time.
Okay, we can go ahead now. Next session. Pawan?
Yes, ma'am. I'm here.
Pawan?
I think, Pavan sir, you are unmuted.
Ma'am, I think this question has been answered by Dr. Dadi's also, like after the CS section, breastfeed can be started.
So yes, it has to be started. Now there's the latest guideline says that even if the baby is born with cesarean section, within 1 hour, if the mother has gained consciousness and if she is in a condition to feed the baby, she has to feed the baby. Earlier it was 2 hours, but now it has been reduced to 1 hour. And for normal delivery also it is 1 hour. Earlier it was half an hour after normal birth.
Okay. Now okay. So coming to the end of this webinar, I invite Ms. Amandeep Kaur.
You should have thanked Dimple for session, nice session.
Yes, ma'am. I've already thanked. Thank you, Dr. Sharma. Dr. Sharma has very nicely enlightened us with the laws and various newer initiatives taken by Government of India and how the Government of India is working just to encourage the breastfeeding and supporting the breastfeeding and educating at the grassroots level. As she has also mentioned in her slide that the Government of India started taking initiative to training the ANMs so that they can motivate the at grassroots level the mothers and they can start early breastfeeding at the very primary level. So thank you very much, Dr. Sharma. So now I invite Amandeep Kaur, a chairperson peer review committee for the vote of thanks. Over to Amandeep Kaur.
Thank you, Dr. Pavan sir. So greetings to everyone present here. I, Amandeep Kaur, chairperson peer review committee, NTI Delhi NCR chapter, would like to propose this vote of thanks on behalf of Nursing Teachers Association of India and Delhi NCR chapter and Pediatric and Neonatal Nurses Forum India. We are indeed very grateful to our respected President, NTI Delhi NCR chapter, Professor Dr. P.T. Kaul ma'am, who is also the National President, PNNFI, for her encouraging and pushing us to take initiatives and achieve excellence in what we do. Thank you so much, ma'am. I extend my sincere thanks to the National President, NTI, Dr. Farooq Khan, and his national team for always supporting our endeavors by all the means and providing us the opportunity to come together and work as a team of Delhi NCR chapter. Thank you so much, sir. I also take this opportunity to express my deep sense of gratitude to our esteemed speakers of today's event, Dr. J.P. Dadi, Senior Consultant Neonatology, Fortis Escort Hospital, Jaipur, and Dr. Dimple Sharma, Associate Professor, AIMS, New Delhi, for their wonderful, elaborative, still comprehensive evidence-based presentation that they enlightened and empowered our audience regarding breastfeeding, breast milk feeding, and various newer initiatives to increase breastfeeding practices. I take this occurrence to wholeheartedly thanks Secretary PNNFI, Dr. HCL Rawat, and Secretary NTI Delhi NCR Chapter, Dr. Pavan Sharma, for all their untiring efforts to make this program successful. A big thanks to all the lovely participants who have joined us even on Sunday morning and gained more wisdom regarding breastfeeding. Last but not the least, I thanks all the organizing team members of National and Delhi NCR chapter of NTI, as well as PNNFI, and anyone else who supported us directly or indirectly in successful completion of this webinar. At the end, I would like to conclude the event by the beautiful quote, which is in Hindi though. शिशु के पोषण का आधार है, शिशु के पोषण का आधार है, माँ का दूध ही सर्वोत्तम आहार है. हम सोचते हैं कि हम क्या कर सकते हैं, हम सोचते हैं कि हम क्या कर सकते हैं, स्तनपान की जागरूकता यही शिशु के लिए उपहार है. So thank you so much everyone for joining with us. Have a very good day ahead. Thank you.
Thank you so much, Amandeep. I have been again and again disturbing you from your busy schedule, but you are very willingly trying to do whatever you could do, and also Pavan, and you will expect in future also you will expect same thing from me, but don't get worried, don't get bored.
No,
Don't get
no.
but yes, at the end of the day, it is done well. So
Thank
I
you so
thank
much.
you all. I thank all the executive members, and I also thank Pavan and in particular Dr. Amandeep for doing good job in preparing the background. We had uh, planned for something else, poster presentation and all, which because of certain reasons which we could not do. That I think we should our next for this next program or activity will be on poster presentation. So I request all the stakeholders, the university, those who are heading our, who are the chairperson, they can take an initiative in making the, because Aman has already prepared some guidelines. Pavan can read those guidelines and share his views, and then they can discuss, and we can ask somebody else to coordinate that activity. But let us prepare the guidelines first, how we should do it. And it has to be done in advance. We should not wait till last moment. We should be ready at least 2 weeks ahead. For though we may just circulate before 2 to 3 days, but the whole planning should be 2 weeks before, because then we can make the changes. We can better improve our quality of brochure. We can improve the quality of the flyer, the program, the pictures. We have still to improve that. So we have to work in advance by thinking that what would be the next activity. And the poster presentation is poster competition is a very important area which we can do. We can take a particular area or theme which is of national importance, and then we can. So I'm so thankful to all the organizing committee, and also all the executive members, and also the members who have been always willing, all the executive members who have conducted so far, they coordinated so far the activity. They have always been willing workers to do work hard despite their busy schedule. And I think for doing the professional activities, we don't have to see the time, we have to deliver. That is what, because during when I was during the conducting of this workshop, I got a phone call from a very, I will not say a very important person, and I had to get up. And I told that they were asking me some query. Then I told that I have retired from IGNOU, and but still they were asking, we know that you have retired from IGNOU, but you have not tired, but you are still working. And a very good compliments they were giving, that you help us in such and such things. So I cannot say to the people that I am retired. When I say that I am retired, they again tell back me, no, you are not retired. You are only, you have completed your service, but you are not tired still. We want you to see this active. So we all are busy. Nursing professionals are very busy and committed also, and we have to continue to do our best. Thank you so much. Thank you all. Thank you very much. Thank you, Rimple. Thank you, Dr. Dadish.
Ma'am, you have retired only from IGNOU.
Huh?
You have retired only from IGNOU only, ma'am.
Huh.
But you are not retired from the
No,
education.
I have not retired from IGNOU. I'm still doing IGNOU's work.
Okay, that's fine, ma'am. But ma'am, you are always there
No,
to
they were
help us.
asking, are you associated you are associated with IGNOU? I said, yes, I am associated with IGNOU, but I have retired. But they said, no, you are still.
Still there. Yes, ma'am. No, what I mean to say is, ma'am, the all this education and all this activity, you are there. You are always there for us, ma'am. Only you are not going 9 to 4. That's all. This is the only change.
Okay.
So just I want to say to all the participants, we have shared the feedback form link in the chat box. So please kindly fill the feedback form and you'll receive the certificate. Yeah.
So certificate, you have written the Rawat's name. Dr. Rawat का नाम है certificate में.
मैम सर्टिफिकेट में सिर्फ डिग्नेटरी के साइन है नीचे मैम.
अच्छा.
अपने वाले हाँ. और वो डाउनलोड कर लेंगे बस. हमें कुछ नहीं करना. When they will sign, they will get the certificate with their name. अच्छा. It can be downloaded. But हम लोगो है. PPN उसका लोगो है मैम.
Okay.
हाँ उसका लोगो.
Thank you, sir. Thank you, ma'am.
Thank you, sir.
Thank you, ma'am. Thank you very
I
much.
can see few
Thank you, Aman.
few participants are making lunch.
Yeah. Okay.
Yeah.
Okay, then
It's
we will
lunch
stop here.
time. Please have your lunch. Have a good Sunday. Thank you for joining with us.
Thank
yes,
you,
everyone.
Thank you, everybody. Thank you.
Good. Pavan also did good job.
जी पानी जी ऊपर। दुनिया में तो ऐसा ही फोन करते करते थक गई। बता देती ना, मैं नहा रही हूँ। हाँ ले आई, मैं तुम्हारे इंतजार में बैठी। मेरे इंतजार में मत बैठिए, आप खाना ले आना। चलो ना वहीं खाएंगे। हाँ तो फर्स्ट लाओ या डालो। चावल नहीं रखना मेरे लिए, या डालो। रोटी रखना बस। ठीक है, आना जल्दी है।